Hi, my name is Dr. Stella Jeffries. Today I will be discussing a very risky procedure called the Brazilian butt lift or BBL and why this procedure must be banned. But first, I would like to give a medical disclaimer. The information in this podcast are for educational purposes only and does not substitute professional medical advice or consultation. What is BBL, or Brazilian butt lift? It is a popular cosmetic procedure that involves transferring of fat from one part of the body to the buttocks in order to enhance a woman's size or shape. Why it is a sought after procedure, it is not without risk or potential danger. Although there have been reports and studies suggesting that Black women may be at a higher risk of complication and death associated with Brazilian butt lift procedure compared to other racial or ethnic groups, the health department or regulatory bodies are yet to place a ban on these daily procedures, which raise concerns about potential bias in the healthcare system.
Hello there. How are you guys? So I wanted to do this live real quick because I want to inform you, I want to share with you lady that we have a great and awesome special today.
Why when they have a major complication, they change their name, because then that way when somebody Googles them, the story doesn't follow the clinic.
Authorities are investigating a death at a Miami-Dade cosmetic surgery center.
There is a growing recognition of implicit bias within the healthcare system, which could contribute to health disparities and differential treatment outcomes across various racial and ethnic groups. Although the decision to ban or regulate specific medical procedures like the Brazilian butt lift depend on various factors and consideration, the health department must take action now to prevent more Black women from dying of this daily procedure. Some of the reasons why the health department might not outright ban Brazilian butt lift is due to, number one, lack of consensus. The medical community may not have reached a consensus on the need for a complete ban on BBL. However, this is affecting the Black community. While there are recognized risks and complications associated with the procedure, it is not universally agreed upon that a ban is necessary or the most effective approach. Why it is important to place effort on enhancing safety guidelines, educating practitioners, and promoting responsible practice, placing some restriction on the procedure is crucial. Another reason why the health department may not outrightly ban BBL is due to ongoing research. Medical research is an ongoing process, and new studies may provide further insights into the risks and safety considerations associated with BBL. Health department may choose to wait for additional scientific evidence before implementing stricter regulations or considering a ban. However, more Black women are dying. Individual choice and autonomy is another reason. The decision to undergo a cosmetic procedure like BBL is ultimately a personal choice made by individuals. Health department and regulatory bodies may prioritize patient autonomy and freedom to make informed decisions about their bodies, provided they have access to accurate information about the risks involved. It is important for Black women to know that it is a very risky procedure and the death rate is rising. So it's important to make informed decisions.
She was actually in here in the living room. And as soon as she stood up, she fell down. I said, what happened? She was just like, I don't know. She was like, but my heart is palpitating. Can you give me something for my heart? She goes to, get up, and I'm standing here and I'm trying to help her, but she wanted to do it on her own. And I'm just standing here, and she gets up and she takes maybe about 3 or 4 steps, and she grabbed my hand. She squeezed my hand extremely tight, and she started to fall back. Her eyes started to roll back in her head. And I had to let her go because I couldn't hold her. So, she fell on the floor.
And he was like, we had complications, but everything's gonna be all right. She went to cardiac arrest, and the first time, I'm like, what do you mean cardiac arrest? And they were like, that's normal. You know what I'm saying? I'm like, that's not normal, but I'm like, is she gonna be all right? And they said, yeah, she's gonna be all right.
The last thing she said to me was, I love you. And that was the last thing we said to each other was, I love you.
When that question come up to me, when he asked me, Daddy, why I don't have a mama? Where's my mama? And I cannot answer that because someone took that away from him, and I don't know how to answer. I can't answer.
It was the worst day of my life. And I've been through a lot of stuff, but it was the worst day of my life. Now, I have not really recovered from that since then.
And it was like, they treat her like she was nothing. You still going with Benny the next day, like, oh well, that's it. We got more here to do. We got more cows to butcher. For what reason? You know what I'm saying? And then nothing's been done about it. And then I hear about this. He's not the first one. And I look at the point, if it had been something done from the beginning, it would have never happened to her.
Regulations in education is another reason why the health department may not outrightly ban BBL. Instead of a ban, the health department is willing to focus on implementing regulation and guidelines to ensure safer practice within the field. This involves setting standards for qualification and training for practitioners, enhancing informed consent procedure, and improving post-op care protocols. Additionally, education campaigns can be launched to raise awareness amongst both providers and patients about the risks and potential complications associated with BBLs. It is important to note that regulations and policies regarding cosmetic procedures can vary between countries and jurisdictions. Therefore, until the health department can place a ban on BBLs, it is advisable to consult the most up-to-date information from reputable sources and seek guidance from healthcare professionals or regulatory authorities in your specific region for accurate and relevant information regarding the status of BBL regulations. There are many potential risks and complications associated with BBLs. Potential risks and complications of BBL include surgical risks. BBL is a surgical procedure that carries inherent risks associated with anesthesia, incisions, and surgical procedure itself. Complications such as infection, bleeding, scarring, and adverse reaction to anesthesia can occur. Fat embolism, one of the most significant dangers associated with BBL, is the risk of fat embolism. Fat embolism occurs when fat enters the bloodstream and travels to other parts of the body, potentially blocking blood vessels and leading to serious complications. This can result in severe health problems, including organ damage and even death. Pulmonary fat embolism. When fat enters the bloodstream during a BBL, it can travel to the lungs and cause a condition called pulmonary fat embolism. This can lead to difficulty breathing, chest pain, and in severe case, respiratory failure. Inadequate blood supply. The process of injecting fat into the buttocks during a BBL can compromise the blood supply to the area. If the blood vessels are damaged or blocked, it can result in tissue death called necrosis, inflammation of painful and unsightly skin ulcer. Seroma formation. Seroma is a potential complication after a BBL where fluid accumulates in pockets beneath the skin. This can lead to discomfort, infection, and delayed wound healing. Asymmetric and irregularities. Achieving perfect symmetric and a smooth contour after a BBL can be challenging. There is a risk of developing asymmetric or irregularities in shape and size of the buttocks, which may require additional corrective surgery. Post-operative care. Following a BBL, patient must adhere to strict post-operative care instruction to reduce the risk of complications. Failure to do so, such as lifting or lying on the buttocks too soon after surgery, can increase the chance of adverse events. It is important to note that the danger associated with BBL can vary depending on factors such as the surgeon's skills and experience, the patient's overall health, and adherence to post-operative care instruction. It is crucial to consult with a board-certified plastic surgeon and discuss the potential risks and benefits before considering any cosmetic procedure. However, due to the fact that the death rate within the Black community is increasing from BBL procedure, it is crucial to avoid this procedure by all means necessary. There have been reports and studies suggesting that Black women may be at a higher risk of complication and death associated with Brazilian butt lift procedures compared to other racial or ethnic groups. This is believed to be due to several factors. Number one, body composition. Black women often have a different body composition compared to other racial or ethnic groups, with a higher prevalence of a condition called gluteal muscle deficiency. This condition makes it more challenging to achieve satisfactory results with BBL, as there may be insufficient muscle support for the transfer fat. Additionally, the lack of adequate muscle tissue can increase the risk of fat embolism and other complications. Hemoglobinopathy is another condition. Certain genetic conditions that affects the red blood cell, such as sickle cell disease, are more prevalent in Black population. These conditions can impair blood circulation and oxygenation, increase the risk of complication during surgery and post-operative period. Surgical technique and experience is another factor. The BBL procedures require specific surgical skills to ensure the safe transfer of fat and minimize the risk of complication. Some studies suggest that there may be a correlation between surgical experience and the incidence of complication. If surgeons who perform BBLs on Black women have less experience or inadequate training, it can contribute to an increased risk of adverse events. There are many reasons why some people may choose to reconsider or avoid getting a Brazilian butt lift procedure. Health risks. Again, BBL carry inherent risks and potential complications, including the risk of fat embolism, pulmonary fat embolism, inadequate blood supplies to the buttocks, seroma formation. These risks can lead to severe health problems, permanent damage, or even death. Considering potential danger associated with the procedure, some individuals may opt to prioritize their overall health and well-being over an aesthetic enhancement. Lack of long-term safety data is another reason why some people are reconsidering or avoiding BBLs. BBL gained popularity relatively recently, and long-term safety data is limited. While the procedure has been performed successfully in many cases, there is still ongoing research to fully understand its long-term effects. Some individuals may choose to wait for more comprehensive and conclusive research before undergoing the procedure. Unrealistic beauty standards is another reason why some people are choosing to opt out of the procedure. BBL has gained attention and popularity in part due to certain beauty standards and societal influences. The pressure to conform to a specific body image can lead to unnecessary risks and dissatisfaction with one's natural appearance. Encouraging self-acceptance and embracing diverse body types can be a healthier approach for many individuals. It is important to consider the psychological well-being of individuals seeking cosmetic procedure. Body dysmorphia, a mental health condition characterized by an obsessive preoccupation with perceived flaws in one's appearance, can drive individuals to undergo multiple procedures in an attempt to achieve an unrealistic or idealized body image. In such cases, seeking professional counseling or therapy may be a more appropriate approach to address underlying psychological concerns. Ethical reconsideration. The demand for BBL has led to an increase in unregulated and unsafe practices, as well as unqualified practitioners performing the procedure. This raises ethical concerns and the need for stricter regulation and standards in the cosmetic industry. Ultimately, the decision to get a BBL or any cosmetic procedure is a personal one. It is essential for individuals to research and weigh the potential risks, benefits, and long-term implications before making an informed decision. Consulting with a qualified and experienced board-certified plastic surgeon and considering alternative approaches to body acceptance can also be valuable steps in the decision-making process. Please like and subscribe to this podcast to get more information on the healthcare of the Black race. Thank you.